Breathing is something most of us do without a second thought. It is the very rhythm of life, a constant, automatic process that fuels our bodies and minds. But what happens when this fundamental action becomes a struggle? When each breath feels like a conscious effort, it can be incredibly frightening and can dramatically limit your ability to enjoy everyday activities. Suddenly, simple tasks like walking up the stairs, carrying groceries, playing with your grandchildren can feel like monumental challenges. This is the reality for many people living with serious heart and lung conditions. It's a situation that can understandably lead to feelings of anxiety and isolation. The good news is that you are not alone in this journey, and there is a tremendous amount of hope. Medical science has made incredible strides, and one of the most powerful allies you can have on your side is a physiotherapist. However, a specialized group of physiotherapists known as cardiorespiratory or cardiothoracic physiotherapists are highly skilled in helping people with heart and lung problems. The role of these specialist physiotherapists is to empower you. They work to give you back control over your breathing and in turn, your life. Let's break down these complex-sounding conditions into simpler terms. First, we have pulmonary edema. Imagine your lungs are like two sponges. These sponges need to be filled with air for you to breathe easily. In pulmonary edema, fluid starts to leak into the sponges from heart-related problems. They become heavy and waterlogged, making oxygen transfer hard. The main symptom is a profound breathlessness that can worsen when lying down. Next is pulmonary hypertension. Think of your circulatory system as roads and highways. Vessels from heart to lungs are usually wide, low-pressure paths. In pulmonary hypertension, those vessels become narrowed and stiff. It's like a highway reduced to a narrow country lane. Your heart must work much harder to push blood through and pick up oxygen. This extra strain can cause fatigue, chest pain, and significant shortness of breath. Finally, let's talk about heart failure. It doesn't mean the heart has stopped. It means the heart muscle is weakened and pumps less efficiently. These three conditions are closely linked. Heart failure can cause pulmonary edema. Both can be driven by the strain of pulmonary hypertension. Understanding these mechanics is the first empowering step. It helps explain how physiotherapy targets these issues and helps you manage them. When you first meet a cardiorespiratory physiotherapist, their primary goal is to get a complete picture of your health. This isn't just about your diagnosis, it's about you as a person. They will start by having a detailed conversation with you about your symptoms, particularly your breathing. They will ask what makes you breathless, how it affects your daily life, what you hope to achieve through therapy, walking to the local shop, playing with your pet without feeling exhausted. Following the conversation, the physiotherapist will conduct a physical assessment. This is done with your comfort and safety as the top priority. They will listen to your lungs, measure your heart rate, blood pressure, and oxygen saturation levels using a small painless clip on your finger. They might also ask you to perform a simple, supervised walking test. This provides a crucial baseline to track your progress over time. Based on this comprehensive assessment, your physiotherapist will create a personalized treatment plan. This plan is your unique blueprint for recovery. A key component is often a tailored exercise program. This might start with very gentle seated exercises, marching on the spot, lifting light weights. Your physiotherapist will teach you specific breathing techniques. This simple technique helps keep your airways open for longer, reducing breathlessness. The positive effects of a structured physiotherapy program can be truly life-changing. One of the most immediate benefits comes from learning breathing control techniques. By using methods like pursed lip breathing, you gain a tool to actively manage episodes. This sense of control can reduce anxiety and allow you to face physical tasks with more confidence. You begin to trust your body again, a massive step forward. As you follow your personalized exercise plan, you'll notice gradual improvement in stamina. Activities that once seemed impossible will slowly come back into reach. This steady increase in capacity is incredibly empowering. It means more independence, more social engagement, and a return to hobbies that bring you joy. Safety is the cornerstone of cardiorespiratory physiotherapy. Your physiotherapist monitors your body's response and teaches you to recognize your limits. For patients and families, this journey with a physiotherapist is a hopeful, proactive step. Embrace the process fully, ask questions, share your fears, celebrate small victories. Working as a team with your physiotherapist, you're reclaiming your quality of life. There is a path to breathing easier and living fuller. Your physiotherapist guides you every step of the way.